Hi everyone, it is March, which means it's Endometriosis month. Those of you who know me, I'm Dr. Ginger Garner. You'll know that I also wear yellow for endo because I have endometriosis. I don't just specialize in it as a pelvic and ortho PT, I also have it. And that impacts me on multiple levels because I have multiple family members with it. So I have a long history of watching my family, of experiencing myself being medically gaslit, of being told that endometriosis is just period pain. X, wrong, no. Of endometriosis just being a disease of the reproductive organs, also wrong, no. And so what I often get is an important question, which is, what can you possibly do with pelvic PT? Isn't surgery the gold standard? And the answer is excision surgery is the gold standard, not ablation. But I don't think that you can really fully recover from endometriosis without addressing these 4 points. And that is through integrative and functional medicine, lifestyle medicine, with preferably a pelvic PT or a pelvic OT or someone who can really guide you through those steps, because that's our expertise. That's what we do. We help you get over and past the surgery. We actually make those referrals for, to surgeons so that you can get top-notch care, because there's amazing surgeons that we have here in the US that are saving lives every day, including mine. Shout out to Dr. Ken Sinervo at Center for Endometriosis Care in Atlanta for saving mine. So, in lieu of our March Endo month, what in the heck do we do with endo as pelvic PT specialists who also specialize, I'm board certified in multiple areas? So lifestyle medicine is one of those, as well as integrative functional medicine. Here's our list. This might be hard to read backwards, so I'm going to point these things out to you. The very first thing that we work on helping you control is inflammation. This is not the only lab measure that we will look at, called high sensitivity C-reactive protein, but it is one measure. It is one measure to help us track inflammation. You can have multiple things when it comes down to the creation of inflammation in the body. There are multiple biomarkers for inflammation. One of those could just simply be nutritional triggers. What's in your diet? Are you consuming things that are actually creating inflammation and driving the disease? So that's the first thing that we look at in conservative endometriosis management. We will also track, other labs and again look at nutrition, but this is one of the things that we will measure. Next is estrogen and estrogen metabolism. Why is that important? Because estrogen is one of the ways and one of the theories that endometriosis is actually mediated, meaning it can be made worse when hormone management is not done well, right? And when your liver is really not metabolizing the estrogen in the way that it needs to. We can experience something called estrogen dominance, which doesn't necessarily mean you have too much estrogen. It could be that you have too little progesterone. You can go to my blog, garnerpelvichealth.com, to read more on what estrogen dominance means and what it looks like. Again, it's not just too much estrogen. So one of the things that we look at are cortisol levels. Are cortisol levels or dyscircadianism, is it backwards? Are you struggling with sleep, right? Are you struggling with stress? Are you struggling with constipation? All of these things can actually drive what's called dysestrogenism and dyscircadianism. And as an integrative pelvic PT who uses lifestyle and functional medicine, I'm helping you manage those things. The other thing that we're going to look at is the environment. There is a theory out there that we have more endometriosis than we think we do. It's more than just the 1 in 10, and that there are more cases than there used to be. But if you look at it, it makes sense because there's more dysestrogenism and potential for that due to environmental toxins in our world. We are just simply living in a more polluted world with more chemicals that have estrogenic effects called xenoestrogens, fake estrogens. And so when we look at managing those, I give you a list of things to look for, things to take out of household cleaners, right? Household cleaners to get rid of, beauty products, personal self-care products that might actually have bad estrogenic effects that we do not want. That's number 2. Number 3, immune function. We want to make sure that your immune system is optimizing at like top-notch function, because if not, that negatively impacts all the other things that I just mentioned. We use lifestyle medicine, little LM here, to improve immune function. And then the last thing is gut function. Plus, down here at the bottom, plus pelvic and orthopedic PT. So pelvic and orthopedic PT is not these things here, right? These are additional specialties that we look at, or that I look at as an integrative PT. But I'm also going to do all the regular things that pelvic PT would do. So we'll look at the gut microbiome and how healthy that is. We look at something called the estrobolome and how healthy that is. And then we look at pelvic PT, which may mean visceral mobilization, myofascial motility, in addition to the other 4 major components. It may mean looking at the pelvic floor, doing imaging of the pelvic floor, and I have 3 videos on imaging that you can watch as well to look at how I will consider imaging in helping you manage endometriosis. You might get pelvic floor retraining, you might get diaphragmatic retraining, you might actually get vocal retraining, because I am also the voice to pelvic floor physio, and I look at treating the pelvic floor from a 3 diaphragm approach. And also as an ortho PT, yes, I'm going to look at the pelvic girdle, the low back, the SI joint, because you can have pain in any of those areas. And so that's important to track those things and look for drivers. If you've had surgery, obviously we're going to take care of all those surgical scars as well, because we don't want those things scarring down and giving you bladder urgency, frequency, creating constipation, or chronic low back pain or pubic pain, for example. So that, I'm sorry if that's a little bit long-winded, but I'm very enthusiastic about helping people with endometriosis, because men can have endo too. And as March is Endo month, I hope this has been informative for you and helpful. If you've liked this video, don't forget to subscribe, sign up for the newsletter in the description link, and I do a limited number of free consults for you if you want me to talk you through that process and talk about how I can help. I can do that as well, and point you towards resources that might actually be closer to you, because there's an amazing number of PTs and OTs who also specialize in endo pelvic therapy as well. All right, thanks for listening.